Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm very pleased you could be with us for this next segment as I interview the very distinguished Dr. Ellie Hattori, optometrist. Dr. Hattori, it's so great you're here. Thanks for coming.
Having me.
Dr. Hattori, I am delighted you're here because I want to know all about contact lenses, and our audience is very interested. So, before we get into that, let's imagine there's a smart high school student watching, listening. How would they become an optometrist?
Well, ideally, they would have had some experience visiting an optometrist for their annual eye examination. And having done that, you know, they would get a sense of what we do. I've actually had several high school students come through with interest in optometry, and I'm proud to say 2 of them actually went through and became optometrists. Yes.
Ellie, that's wonderful. You're a great role model. And in fact, just a little mini personal story. I was in Monterey yesterday, and someone saw our conservative advertisement promotion that you were going to be on my program. And that person said to me that you have been taking care of his eyes for over 20 years. How long have you been on the peninsula, Ellie?
Well, my husband and myself have lived on the peninsula for 40 years.
Amazing.
And initially when we arrived in Monterey, I was not practicing. I was raising our children. When I came back to optometry, I found that contact lenses was something I really had a passion for. It really interested me. So for the last, over 25 years now, I've have concentrated only on fitting contact lenses.
Well, Ellie, that's terrific. And if we have a moment, you know, before the close of this segment, I'm going to ask you about baseball and Little League baseball. But that's a perfect segue because when I was in Little League, I got my first pair of contact lenses, which were hard, right? And they were uncomfortable at first to get used to.
Right.
So let's talk a little bit about the history of contact lenses. Let's talk about those hard contact lenses. I wonder if anyone still uses those.
Well,
and let's talk about our new gas permeable lenses, soft lenses.
The soft lenses, yeah.
Right.
Originally, the hard lenses, the true rigid lenses, were the first lenses. Those lenses were indestructible. They gave beautiful optics. Unfortunately, however, they didn't give you a lot of breathing. There wasn't a lot of oxygen, so they weren't the healthiest lenses to wear. Consequently, they were really tiny, so that it wouldn't cover a large surface of your cornea. After that, in the 70s, no, before the 70s, in the late 60s, they decided to make that rigid lens more breathable, so we came up with the rigid gas permeable. Luckily, in the 70s, we had the arrival of the soft lenses, and that's now what the majority of the population is wearing.
So, Dr. Hattori, isn't it true that some of the oxygen that our cornea needs and requires comes right from the air?
Comes through it comes through the lenses, and that's what's so unique about what we have today. The lenses today breathe better. They are more comfortable, and the optics are better. Much better than we had even, say, just, 2-3 years ago.
Okay, so I want to learn all about the different type of lenses available and how you help a person choose what lens is best for that person. So is it true now that the newer lenses allow more oxygen to come through, right through the tear layer and actually get to the cornea, which is mandatory? I mean,
absolutely.
I mean,
the lenses, the lenses today, just compared to, say, 5 years ago, probably allows 5 to 7 times more oxygen to come through. I mean, it's phenomenal. That's why you hear ads and in the magazines, you hear about lenses being advertised as approved to sleep in for 30 days. I'm sure you've probably seen that. And, and that gets very confusing because these lenses today are that breathable. But there's another issue, another component to sleeping in lenses that is that's another story in itself.
Oh, okay, so there's a variety of lenses, contact
There's
lenses available.
many lenses, correct.
So why is it that someone would have a lens that they use for 30 days and then discard? There are other lenses where you use once and toss.
Yeah, that's a good question, right.
And then, like you
Exactly.
said, some lenses you're supposed to take off before you go to sleep. Other lenses, the newer ones, it seems like it's okay to sleep in them. Is that right?
Well, contact lenses are regulated by the FDA. And before a manufacturer can bring a lens out to the market, they have to go through many tests. One of the tests that they have to do is to make sure that it does what the manufacturer says it does. So for what the FDA does is for that period of time on which the lenses are designated for, they make sure the lenses are performing at their optimum. They give you the oxygen that says it does. It gives you the comfort it says it does. It gives you the optics it says it does. So consequently, they now name these lenses for that period of time. If you choose to wear the lenses past that period of time, there's no guarantee. In fact, you are wearing it beyond recommendation.
Okay. So, but there are some lenses that we'll use for a month, right?
Correct. Because during their testing of the FDA, they have proven themselves to be able to perform in the different categories for that length of time.
Okay. And then other lenses that people use one day and then...
That's correct, because after one day, the FDA testing have proven that it no longer will perform at the level that it needs to be.
Okay. Well, Ellie, you know, before we go on, I recall when I was a kid, maybe even preschool, I remember watching a basketball game, and the athlete had
to look for their lenses underground.
Must have been a hard contact lens.
Yes.
The entire game came to a halt, and the referees and the players were out there looking around, and they found it on somebody's sneaker. And part of the reason, I guess, was because contact lenses were so expensive and so hard to replace.
Fortunately, we don't see that any longer once we had the introduction of the soft contact lenses. Those were the smaller, rigid lenses that pops out very easily.
They just pop out.
And it just pops out. In fact, that's how you remove them. You kind of pull on your eyelids and the lenses pop out. With soft lenses, they're larger, they are more secure on the eye, and they rarely do come out. In fact, to take them off, you have to go in and physically have contact with that lens to remove.
Okay. Well, Ellie, that leads me to another question, if you don't mind, is why is it that for athletes, contact lenses seem to be so much more preferable or lead to better performance than spectacles, than glasses, right? Well, why is that?
Contact glasses have its limitations. When you look through a pair of glasses, you can only see as far out as the limit of the frame. With contact lenses, because it sits directly on your eye, the periphery is just wide open. So consequently, for athletes especially, the performance they see increase many times fold.
Okay, well, Ellie, what about youngsters that need vision correction? Like a lot, I think in the grade schools now, don't they measure the children's refraction? They measure their vision in a lot of the schools, right?
Well, that's how it used to be. Unfortunately, nowadays, with budget cuts, the children don't get the vision screening they should be getting.
Well, I wasn't aware of that, but let's picture the person, the youngster in grade school. Now, can that youngster have contacts, or they have to get glasses and then wait till they're 18?
No. The youngest patient I have fitted, I believe, was 8 years old. And the reason why was because he did have a significant correction, and he was a baseball player. And it was just phenomenal. Contact lenses, for myself, that's why I'm in optometry, is because I have a very high correction. And that's why I love fitting contact lenses, because it can change not only how a person sees, but how you feel about yourself and how your performance. It just has so many positive ramifications.
Ellie, that's terrific. Now, can you teach us what we mean by astigmatism, and tell us if someone with astigmatism can wear contact lenses?
Sure. Astigmatism is when your eye curvature of the front of your eye, your cornea, is not symmetrical. So if you can imagine a baseball, it's completely symmetrical. A person with astigmatism has two different curvatures, so you might look at it, say, like a football. One side is more curved, one side is more flat. And this is just the way the eye happens to grow. In glasses, it's very easy to correct because you just put the prescription where you need it, and it sits on the bridge of your nose, and it doesn't move. It's very stable. In contact lenses, what we do is we design the lens just the same way, but unfortunately, it doesn't have anything stable to sit on, so we have to manufacture this lens and design in such a way that it has a stabilizer. And that, again, with current lenses right now, that stabilizer is very important, and it has improved on making it so that your vision is much more stable, is much more consistent.
Okay. Ellie, is that what we mean by a toric lens?
Exactly.
So a toric lens
corrects for astigmatism. Yes.
Okay, so what that contact lens has, if someone has astigmatism, different corrections in the different vectors,
meridians
different meridians. Okay, perfect. Okay,
exactly.
so I hear a lot about dry eyes. Now, if someone has dry eyes, do they stay away from contacts, or they still can wear contacts?
With today's material that are available, it addresses dry eyes. In fact, there's a lens that came out just this year. When they did the testing on this lens, from the beginning of the day to the end of the day, that lens had the same amount of moisture in it. I mean, that's how incredible and how advanced technology has gotten in this field.
Okay. Well, Dr. Hattori, what about these ads I see? I think we've just touched on it briefly a few minutes ago. The lenses that they say it's okay to sleep in. Now, what about the oxygen and tear film, the film tear, or the film, proper tears getting to the cornea?
Yeah. There's two elements that we are concerned about when a person's sleeping in their lenses. One is not getting sufficient oxygen. Today, with the materials that are available, they get sufficient oxygen. They are so breathable. The second factor, however, is the debris that you collect during the day. Unfortunately, the only way you can get rid of debris is to rinse it off and to clean it. So if you wear that lens at night to sleep and you don't clean it off, your eyes may be breathing, even with your lids closed, but that debris isn't getting washed out. So it actually is, because it's dark and moist, it's a perfect petri dish. Yes. So what I appreciate having these lenses that are so breathable is that during the course of the day when you are wearing them, you're getting the best of the oxygen level.
Okay. Now, Dr. Hattori, there's this phrase, a corneal abrasion, that I'm sure we could talk about corneal abrasions for hours. We don't have that much time. But I heard about someone who had a tendency towards cornea abrasion, and instead of hearing from her doctor, you should not wear contacts, she was actually fitted with special contact lenses that seemed to minimize her tendency towards getting a corneal abrasion, which surprised me.
Right. In that particular case, she may have what we call a corneal. When you wake up in the morning, sometimes you have what we call the cornea would slough off, and so the contact lens actually would protect that from happening. Sometimes we use contact lenses as a Band-Aid, as a bandage lens to administer. Maybe if she had a corneal abrasion, it would protect it.
I see. And now the eyelids themselves, when they open and close, of course, they're designed to be silky smooth. It's an incredible structure. Now, does the contact lens can guard against maybe the eyelid coming down over the cornea? I'm not sure how.
Yes, because it would be like a Band-Aid. It wouldn't rub against it, as closely.
Okay, so when you see a person in your office now, current treatment, do you tend to recommend contact lenses that they throw away every day, or they can keep for a month, they clean every night, or can they sleep in them? Like, what's the sort of current standard?
There's nothing like something fresh on a daily basis. If the parameters are available for the individual and their lifestyle in a one-use contact lenses, that's what I would highly recommend. Just this past year, we've had a one-use lens that is revolutionary. It's called a water gradient lens. And what's happened with this lens is it utilizes in the center of the lens the best in technology for optics and oxygen. It's wrapped literally around this lens water so that when you put it on, it is so comfortable you don't even feel it. And I have to say with this particular lens, it really, in all these years, I have not heard as many times the wow factor when they put them on.
That's great.
Yeah.
Well, Dr. Hattori, we only have a couple seconds left. Just very briefly, I understand your office sponsors Little League teams.
Yes, we do. And
And-
that's because of my husband.
Well, that's awesome. You're sponsoring the kids
Yes,
and
we've
baseball.
been doing it for, golly, close to 30 years now.
Have you had any winners? Your
Oh,
teams?
absolutely. We've gone to Bronco and won the whole series.
Dr.
Yes.
Ellie Hattori, that's just great. Now, I want to give out your phone number, or if you have a website,
Sure,
in case somebody has a
Absolutely.
question about contact
I'd love
lenses
to give
or
that to you.
anything else.
It's,
So, Dr. Ellie Hattori, and you're an optometrist, and you're right here in Monterey.
correct.
So, if somebody has a question about contact lenses or anything else,
Yeah, please call me. My email is drellie@hattorivision.com. Our website is hattorivision.com. We're located right on Pacific Street, right across the street from the Monterey High tennis courts. We would love and encourage if you have any questions or concerns, anything about your eyes. For me specifically, contact lenses. It's one of my favorite subjects. I love to talk about it. It's constantly changing. If you've had in the past been told you cannot wear contact lenses, there probably is something out there now that we can fit you with.
Dr. Ellie Hattori, and I think there's a phone number I can give out, right?
Correct. That's right.
831-372-8181. Dr. Ellie Hattori, optometrist, 831-372-8181, and hattorivision.com, right? Dr. Ellie at hattorivision.com. Well, Dr. Ellie Hattori, you're amazing. What an expert. I'm delighted to have you here, and I hope you come on again.
Well, thank you for having me.
My pleasure. Once again, this is Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and we're going to take a very brief pause for a very good cause. Please stay tuned.